friends, it's Carla, your online doctor, with today's Live in 5. Today is November 2nd, at 5 p.m. So there will be no live tomorrow because it is election day, and I'm sure people are going to be busy watching the television set to see what is happening to our country tomorrow. Please do not post any comments political. I will delete them. Just saying. Okay, so the big question continues to be, will you get a COVID vaccine if and when one is released in the coming weeks or months or whatever? Okay, the fact that we are talking about mass vaccination for a disease that was totally unknown literally just a year ago is mind-blowing. Okay, vaccine development takes decades, yet here we are talking about vaccinating everybody on the planet. Okay, that speed to development has led to a lot of uncertainty, and recent surveys suggest anywhere between 40 and 70% of U.S. adults said they would get vaccinated. Okay, but 40% is a very low number. 70% is, to me, kind of surprising. I'm reading more 50%, like flip a coin, I don't know. Researchers from Cornell University surveyed 2,000 adults, representative of the U.S. population. Instead of asking them if they would be more or less likely to accept a vaccine given certain conditions, they were actually presented with two different theoretical vaccine profiles. And they had to choose which one they would take, or if they would take neither one. Okay, so for example, vaccine A has an efficacy of 60%, with major side effects reported in only 1 of 10,000 individuals. It was made in the United Kingdom and endorsed by Republicans. Again, don't get political, this was just a study. Vaccine B, on the other hand, had a lower efficacy rate of 50%, with major side effects reported in 1 in a million. Okay, so much less likely than 1 in 10,000, right? Made in the United States and endorsed by Democrats. Now, the elements in the profile, efficacy, side effects, where it was made, who endorsed it, etc., were varied randomly. Okay, so they could figure out how one factor might move the needle towards vaccine acceptance. And what did they find? Okay, the most important factor to the people tested or polled was vaccine efficacy. Okay, meaning that it works, right? People were 20% more likely to accept a vaccine if it was 90% effective. Good luck. Okay, compared to a 50% effective vaccine. Now understand that the FDA has put a 50% efficacy as the minimum acceptable threshold for them to approve a vaccine for COVID. So they will accept any of these vaccines in trial if they can prove that they are 50% effective. That's a coin toss, okay? So also remember, the flu vaccine for years has had an efficacy closer to 40%, yet people flock to get injected. Why? I have no idea. Okay, when looking at side effects in this study, a vaccine with a 1 in 1 million risk of major side effects was only 10% more likely to be accepted compared to one with 1 to 10,000. That's the same as 100 in a million. 100% increase in odds of major side effects, and people still don't see that that's concerning. I mean, seriously, 1 out of a million versus 100 out of a million. People, that's huge. It's not just an extra 2 zeros, okay? People in this study did not like the emergency use authorization approval of the vaccine, yet that is likely the way it's going to be released. It's not going to be released with total approval, this is beautiful, this is wonderful. It's going to be emergency use authorization, meaning fingers crossed. Okay? Vaccines from the U.S. were most trusted. Those made in China were only 15% less likely to be accepted by study participants. Seriously, people, after all that's going on, only 15% less? I'd be thinking 100%, right? Okay, Republican, Democrat was not concerning at all. The study group wanted endorsement from the CDC and the World Health Organization. Okay, they wanted it from more reliable medical sources. So here's the best vaccine case scenario: an efficacy of 90% or more, major side effects in 1 out of a million, made in the USA, endorsed by the CDC, full FDA approval, led to an acceptance, yes, I will get vaccinated, of 70%. Just so you know, this will never happen. Those numbers will never exist. The worst case scenario vaccine was an efficacy of only 50%, major side effects in 1 in 10,000 individuals, made in China, endorsed by Republicans. Again, I'm just reading the study. Emergency use authorization only. Okay? And that was an acceptance rate of 12%. Okay? So more likely we are looking at something in that category, although not necessarily made in China. So 12%. Seriously, that is the numbers. Again, it was a small group of people. It was only 2,000 people, but it was a random population from different population groups to make it more representative of the United States. Again, I didn't see the exact breakdown of the numbers of people, but that's where we stand. Okay, so here we are. Tomorrow's election day. Make sure you do vote. Go out and vote. Use your right to do that and to choose, and let's move forward. Okay, regardless of who is chosen tomorrow, please, let's move forward. Let's become peaceful again. Let's return whatever we can of this country back to its amazing, wonderful thing that U.S. is known for. So on that note, have a wonderful day, have a wonderful election day, and I will see you again on Wednesday for another Live in 5.